Howdy, everybody. We have a great show tonight on tonight's Poop Tip Tuesday. We're going to talk about what antibiotics can do to your gut health. We'll discuss how the heart and the gut are related, because this is actually National Heart Week. And we'll discuss, is healthy aging connected to your gut microbiome, and more questions. Your questions live on today's Poop Tip Tuesday, guys. Don't forget, let's talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. All right, well, thank you for joining me tonight. We have a great show today. If you're joining me for the first time, my name is Dr. Islam, and yes, I am your poop guru. I'm trying to give you the best tips and tricks to help out with your life. If you haven't already, don't forget to subscribe to my social media channels, and also let me know. I love to hear my audience. Let me know if you're watching this live or on the replay, and also let me know where you guys are watching this at. I want to know where you guys are at, and if you have a question you want me to answer live, put them on the comments in the stream, so I know what you guys want to ask, and I can answer those questions during today's live video. Every 2 weeks I go live on my social media channels to answer your questions and to go do some deep dives on a couple of topics as well. David, it is good seeing you. Thank you for watching the live stream. Sophia, is good seeing Sophion, good seeing you. Arika 57, good seeing you. Crocus Flower, good seeing you as well. We'll answer that question on the live stream in just a little bit. All right. 3 topics we'll go into today that I have prepared, and then we'll go over any questions you guys may have as well. Hope you guys had a great weekend. Hope you guys watched the Super Bowl. I enjoyed the Super Bowl. I had no one I was really rooting for, but I thought it was a great game. Let me know in the comments if you watched the Super Bowl and if you had a favorite commercial, because I have one of my favorites that I saw on the Super Bowl weekend as well. All right, topic number 1. Hey, Dr. Islam. What do antibiotics do to your gut health? Fantastic question. I love this question because we use antibiotics all the time. Anytime we're sick, we want to get an antibiotic. Sometimes we can go to a doctor for whatever, we get an antibiotic. If we're wondering something else is going on inside, or we feel kind of bad, we want to get an antibiotic. And it totally jacks up your GI tract. It really messes us up. It can affect things even whenever you are very, very young. In fact, we have seen studies in which if you take a consistent amount of antibiotics when you are young, it can really lead to long-term consequences when you are older as well, leading to conditions like dysbiosis, leaky gut, irritable bowel syndrome, constipation, diarrhea. It can really jack it up. What happens when you take an antibiotic is that you take this pill and it just destroys all the bacteria, good guys and bad guys, inside your body. And the whole point of antibiotics is to get rid of bad bacteria. But in doing that, it can also wipe out some of the good guys as well. Luckily, your body has the capability to replenish those good guys, but sometimes those bad guys can also get replenished and lead to long-term consequences. And also, sometimes those bad guys can overwhelm the good guys, especially if you take more than your necessary share of antibiotics. Now, it can cause changes in your gut microbiome. Your gut microbiome is made up of trillions of viruses, yeast, fungi, and bacteria. And sometimes taking these antibiotics will get rid of those bad guys, and it can lead to problems like C. difficile, diarrhea. Let me know in the comments down below if you've heard about this. It can also lead to what's called antibiotic resistance as well, meaning the antibiotics that we do take may not be as effective, or we can get resistance to this, which can also lead to long-term problems down the road. So if you've been exposed to antibiotics, if you've taken a lot of antibiotics, or if you know somebody who has, this is what I recommend for you to do. I want you to do 5 things to help improve your bacteria, improve your microbiome, to make sure your microbiome is not whacked out or destroyed by taking these antibiotics. Number 1, make sure you take antibiotics only for necessary indications, meaning you are treating a bacterial infection. Guys, antibiotics do not work for the typical viruses you may be getting. So don't take it for that. And the vast majority of sicknesses are due to a virus. So make sure you're taking the antibiotics for a specific reason. The reason being we are trying to treat a bacterial infection going on, not a virus. Number 2 is that I would recommend for you to really go on more of a plant-based diet. This has been shown to help improve your gut microbiome. It is the best diet for your gut bacteria. And what we have seen is that the best predictor of a diverse microbiome is more of a plant-based diet. The more fibers you have, the more probiotic foods that you have, the more you fuel the natural bacteria. This is going to protect your gut from taking antibiotics. Number 3, try to minimize processed foods and try to minimize foods that have a lot of sugar, a lot of fats, and a lot of oils. These feed the bad guys and can make it more likely for you to have really bad issues when it comes to your gut microbiome. Number 4, try to minimize alcohol. This is going to make things worse for your GI tract as well. And then number 5, I would highly recommend that you really intake your fiber. Fiber is the fertilizer for your gut. It works great, helps to minimize the inflammation, but more importantly, helps to fuel the good guys. So if you do have to take an antibiotic, it allows the good guys to replenish and to minimize the bad guys. Big question I always get from a lot of patients. So Dr. Islam, should I also take a probiotic when I take an antibiotic? And the answer is we don't know. And this is the issue, is that probiotics have a lot of marketing, a lot of myth, very little science. And the issue when it comes to probiotics is that we're assuming that one little pill that's already pre-made is going to change what's going on in each individual microbiome. My microbiome is different from my wife's, different from my kids, and different from yours as well. And it's hard for us to say that taking one probiotic is going to affect my microbiome the same as it's going to affect maybe yours. Having said that, for some individuals, there's very minimal risk, and so I would recommend for you to consult with your doctor. But these other recommendations I give will do a better job of improving your gut microbiome, especially if it's been destroyed by taking antibiotics. All right, great question. All right. So if you're joining me now, my name is Dr. Islam, and yes, and I'm an actual poop doctor. What I want you guys to do is to like my page, share this page, share this live, but also let me know if you're watching this live or on the replay. I really want to know where you guys are from. So Taz, is good seeing you. Candy, it's good seeing you. Linda, it's good seeing you as well. Cruz, good seeing you. Marcus, good seeing you. Lil Joven, good seeing you from Toronto. Beverly, it's good seeing you. Jiggle Fan, good seeing you as well. All right, and Christina, good seeing you as well. All right, so let me go through some questions here. So Beverly asks, can reflux affect your lungs? It's a great question. Let's talk about it now. So Beverly, the answer to this question is yes, it absolutely can. Did you know that one of the symptoms of reflux can be pulmonary fibrosis or even asthma? Let me know in the comments if you knew this or not. And actually also chronic cough as well. And so what happens when you have reflux as the cause for lung issues is that acid goes up into your esophagus and actually goes into your mouth and goes into your breathing pipe as well to cause irritation to occur. And that irritation can cause chronic cough. That irritation can cause asthma. And that chronic irritation can cause what's called pulmonary fibrosis. Now, you may not even feel like you have acid reflux, and it can cause issues in your lungs. It's called silent reflux. It actually is a pretty common entity and a common reason why you may have a chronic cough. Now, one of the best ways we can test for this is to put you on an acid medication. And your clinical response to that acid medication, if it gets your cough better or worse, will allow me to predict if reflux is the cause for your lung issues or not. And so, yes, great question. Reflux can affect the lungs. I'm glad you asked that question. All right, question number 3. Hey, Dr. Islam, how does heart disease affect the digestive tract? So this is in celebration of National Heart Month. Happy National Heart Month, everybody. Hope you guys are having a great heart. Now, what do you guys think? Do you think that the heart can affect the gut, or can the gut affect the heart? Well, the answer for this is yes, it can, both ways. A bad microbiome has been shown to actually cause issues with heart problems, or at least have you to be more likely to have heart issues. things like high blood pressure, hypertension, CHF, other heart disease, plaques in your heart can actually be a consequence sometimes of the diet that you eat, which in turn can affect your gut microbiome. We also know too, if you have a bad gut microbiome, the products of that can lead to other issues going on outside the GI tract, including your heart and other areas associated with that as well. So yes, there is true. And what I tell my patients is that the diet that's good for your gut is also the best for your heart. And what is the best diet for your gut? I stress this over and over again, a plant-centric diet. That is the best way to help improve not only your gut, but your heart as well. Adding lots of fruits and vegetables is going to do the same thing as well. And also if you add fiber like psyllium, psyllium is fantastic. It's one of the best fibers that are out there. It works both for your gut. It actually has been shown to decrease cholesterol, and also great for your GI tract as well. And if you can add that into your diet and incorporate that into a plant-based diet, you're going to have two benefits. Not only is your gut going to be happy, but your heart will be happy as well. And we all want a happy heart. I know we just celebrated Valentine's Day, and I want you guys to have a happy heart as well. All right, let's go through some more questions here. A little update, good seeing you. Thank you for watching in St. Louis. And Cindy Ramirez, thank you for watching as well. And Cindy Martinez, good question. We'll go. Debbie's good seeing you as well. Perfect. All right. So Cindy, you asked a question, a pretty specific question. Can intestinal metaplasia turn into cancer? Well, what this is actually, it's actually a pretty good question. So we have some cells inside our stomach that after either because of an infection like H. pylori, or sometimes genetics, sometimes even diet like smoking or having smoked foods, can change the transformation of the cells in your stomach. And that happens all throughout the body as well, but specifically for your stomach, that's called intestinal metaplasia. And yes, there is a risk factor of this developing into stomach cancer. Now, it depends on a lot of different factors: ethnicity, age, diet, genetics, if you have a family history of gastric cancer or stomach cancer or not. So typically for these patients, we may want to do taking a look with an upper endoscopy every few years, make sure everything's doing okay, try to modify our diet, try to minimize the amount of smoked foods, meats, and try to improve our diet by having more of a plant-based diet. This has been shown in multiple studies to help minimize that risk of developing a cancer of the stomach, gastric cancer. So yes, you can do that. It is a great question that you're asking me on that as well. Good job. Great question. All right. So next question. Hey, Dr. Islam, is healthy aging connected to your gut microbiome? Let me know in the comments down below if you think this is the case. Do you think that healthy aging and your gut microbiome are related? Well, the answer to this is maybe. We're not quite sure yet. We just don't know, to be honest. The data and the research on the gut microbiome is so new and so recent that we just don't have a lot of information yet coming into that. However, what we do know is that the gut microbiome affects a lot of different things outside the GI tract: the heart, the brain, your skin, and also potentially how long we have to live as well, and the aging process. And we do know that as we get older, our microbiome does change. Now, is that a consequence of changing because we're getting older, or are we having the effect of that because we're not improving our gut microbiome as much as we get older? We just don't know the answer yet, but I anticipate we're going to have an answer very, very soon. So what can you do to age better? Maybe you're like me, you're getting older, you're like, oh my goodness, I feel my age. I want to do everything I can to make sure that I age well. Well, here's what I recommend based on the evidence that we know. Number one, diet plays a huge role when it comes to your microbiome and age. I stress this to all my patients, and I stress this to everyone. You cannot outlive or outrun a bad diet. You cannot. And so you need to try and incorporate as much plants, a plant-centric diet, minimize the amount of meat, minimize the amount of processed food. This is going to tremendously help out when it comes to your microbiome and aging. Number 2, we have found that fasting has been shown to help out with longevity and aging process as well. And if you look at a lot of the studies, both on animals and in humans, the more you can kind of restrict your diet and not overeat, the better it's going to be for you. Number 3, constantly moving plays a big role when it comes to living longer. Now, this is not constantly exercising, no, even though it's great for you, but it's moving, whether it's walking as much as you can, whether it is exercising, whether it's getting up. Our sedentary lifestyle is actually limiting how much we can live. And studies after studies suggest that constantly moving, getting about, walking around does increase the chance of you living longer. Number 4 is that having a smaller amount of meal. There is this concept called harubachi, which is basically where you eat just to satisfaction. Not to eat where you're full, but just enough where you feel satisfied. You could eat more, but you don't. And there have been so many studies to suggest this can really help out when it comes to living longer, and not only that, but having weight loss as well. Also, if you're doing the things that are going to lead to worsening aging, whether it's smoking, whether it's alcohol, whether it's obviously drugs, things like that, obviously you need to avoid that so you don't age any longer. And then lastly, having friends, decreasing stress, having a community, this actually does matter. Absolutely it does. Whether it's community with church, whether it's your neighbors, whether it's family, the community environment where you're with everyone makes a difference in terms of living longer and living the way that you want to live. And that can also help improve your gut microbiome as well. But these are things that I recommend that have been shown to help improve your gut microbiome. And by doing that, we also can hopefully live a little bit longer. Let me know in the comments down below. Do you have other tips that you recommend for my audience on what we can do to maybe live longer? What have you heard? What have you seen? Or other tips to help out with your gut microbiome? I'd love to hear what you guys have to say. Hannah, thank you for watching. I appreciate you watching from Ohio. Tway, it's good seeing you. Thank you for watching. Jalen, thank you for watching as well. Virginia, thank you for watching. And TC, thank you for watching as well. So, all right, let me go through some questions here, guys. You guys have. Javier, thank you for watching from San Antonio. I appreciate it. I actually have family in San Antonio. It's a great city. All right. Let's go through some questions. Sorry, I can't speak right now. Let me know in the comments down below if you have any questions you want me to ask as well. So Crocus Flower asks, does gluten, yeast, oats cause gas? So maybe it does, maybe it doesn't. For some people, yes. So, there's this issue about gluten. I have a lot of videos about gluten, so I would encourage you to go to my Facebook or YouTube page or even Instagram page on this. But gluten has gotten a bad rap recently. Now, gluten in of itself is not bad, nor is it dangerous. Now, there are some individuals that are gluten sensitive, but more importantly, there are more individuals that actually are FODMAP sensitive. Say what? Yes, FODMAPs. These are certain carbohydrates that have been shown to increase the amount of gas inside your GI tract, and gluten has shown to be one of them. Now, the best test to see if you have a sensitivity to gluten is to try it, seeing how you do. If you feel better, well then, if you feel better on a gluten-free diet, then you have a gluten intolerance. If you don't feel any difference, that's your answer right there. You don't need any fancy testing. You don't need any fancy food allergy, whatever. All you have to do is use your body as a metric to see if this works or not. And obviously, if you don't have any issues, then you're clear. Now, the only exception is if we're worried about a condition called celiac disease, which is an autoimmune disease in which your body actually attacks itself because it ingests gluten. There are tests that we can do to see if you have that. But if you're worried about gluten causing gas, the best thing is to try it, seeing how you do, and your clinical response to that will give you that answer. Great question. All right, let me just go through some more questions here. So Marcus asked, should I take probiotics after taking antibiotics for diverticulitis and increasing fiber? It's a good question, Marcus, and I'll tell you, we don't have any good evidence at all that taking a probiotic is going to decrease your risk for developing diverticulitis or to help out with that. Here's what does work, and I'll tell you, we have evidence for that. What increases your risk for diverticulitis are smoking, Taking non-steroidal anti-inflammatory medications, Aleve, naproxen, Advil, Motrin. Constipation. Also, what increases your risk is a meat-based diet. So I tell all my patients, if you can avoid as much meat as you can, increase the amount of plants. What plants do, it actually does a couple things. Number one, it adjusts your gut microbiome to improve the good guys and help eliminate the bad guys. Number two, it actually adds fiber to your diet to actually help out with things that pass through. So that's going to help out more than anything else when it comes to helping to treat diverticulitis. Great question. All right. All right, guys, let me know in the comments. I'm actually curious if you have a topic you want me to talk about in the future, or if you're enjoying these videos. I'd love to hear what you guys have to think. I'm really curious to see what you guys think. Sorry. Good. Cool. All right, perfect. Well, I think I've gone through most of the questions here, guys. So TC, you have a question here. My ingredients on my colon poop smoothie. I will for sure let you know that pretty quickly. So stay tuned. We'll talk about that very quickly. And if you haven't subscribed to my newsletter, be sure and do that as well. All right, guys, I think I've gone through most of the comments here. I appreciate that. All right. Well, thank you for watching. I appreciate it. Don't forget to subscribe to my channel. If you're enjoying these videos, I really would appreciate it if you smash that like button, comment down below, and don't forget to subscribe to my channel where you can get great tips like you're watching in today's video. And guys, don't forget, let's talk about poop. Thank you, everybody. Hope you guys have a happy and healthy day. Take care, guys.